I'm Dr. Rick Schlussel. Welcome to Presence Wellness Center. Today, I'd like to talk about the main chiropractic techniques that I use in adjusting patients. I use a variety of chiropractic techniques based on what a patient's needs are. Some are more traditional, of the classic popping, cracking techniques. Others are more easy, no twisting, popping, that kind of thing, that are lighter for people that are either more uncomfortable with getting adjusted, whether it be just their neck or some other part of the body, or more frail or concerned about maybe the chance of fractures or those types of things. So to begin with, I check the neck, checking for each individual vertebrae to see which one is out of alignment, or the term we use is subluxated. I'm also feeling for any kind of muscle spasms, swelling, obviously if a patient has pain or not, to assess where the subluxation is and where do I need to adjust. So for her, she has one down here at the bottom of her neck at C7. So I'll adjust her in this direction like this. So I'll move it to the side, good, let your head relax there and your shoulder relax. There we go, nice. I make my adjustments very specific and try not to move the neck too much. I don't want to create any other stress or strain on the muscles or ligaments than I need to. She also has a subluxation up here at C1, so we'll adjust that one too. Relax here. Nice. Great. And that's a cervical adjustment. Another area that I adjust often is the jaw. For many people, they have jaw misalignments, stress, strain. A lot of people clench or grind at night. So I usually do a full jaw examination. In this case, I'm checking to see which direction the jaw is restricted. In her case, it's on the right side. Most of my jaw adjusting is done with an activator, which is a spring-loaded adjusting tool that I can set for particular tensions. And then I can check before and after and see how that jaw has moved, which is much better now. There's still a little bit on the left side now. I often do more than just adjusting the jaw, and I'll do some soft tissue work with the muscles and the fascia in there as well, depending on what a patient needs. So the next area that I'll demonstrate is the thoracic spine adjustment. The thoracic spine runs from just below the neck down to the lower back. And I have found that one of the easier ways to adjust on a patient, or more comfortable ways, is what's called an anterior adjustment, which is this. With the patient lying on her back. Let your breath all the way out. Good, rest back under my hand. Good. Very simple, very direct, very specific. Do another one here, let your breath out. Nice. So the next adjustment that I'll demonstrate is the lumbar and or pelvic adjustment. Both are done in this same position. All right, let your breath all the way out. So next I'll show you the drop table, which is a way of using gravity and then a sudden drop to make the adjustment. So that there's no twisting or popping. We don't usually hear a popping sound on this one. And in this case, I'm going to demonstrate adjusting the pelvis in this. And for that, I also use what are called SOT blocks, and we'll place those blocks in a specific direction based on the way the pelvis is misaligned. There. And then I'll prop the table up. And the table will make a loud noise, but really not much on the patient at all. Very light on them. Here we go. Let your breath all the way out. Good. Relax here. Very good. Now, not only should the spine be adjusted, which is, pretty much every chiropractor will take care of the spine, but I've also found that the extremities are very important, so I don't want to ever leave those out, because as the foot and the knee and the hip goes, so does the neck and the low back and the shoulder go. The old adage, the hip bone's connected to the knee bone, it's really true. So, for a hip adjustment, very light. This is one that most people really like. Relax your leg here. Good. For a knee adjustment, very similar to that. Nice. And a lot of people have foot problems, often due to their shoes and whether the choices in footwear. I see it a lot in the summertime when people are wearing flip-flops for hours on end. So I can adjust an ankle. Great. And then I also detail the rest of the foot. and then even the toes as necessary. Great. Okay, next is for the upper extremity. So adjusting, I'll often adjust, it could even be the clavicle, either where it attaches to the sternum or where it attaches to the acromion process at the shoulder, and the shoulder itself, which is a common subluxation. And for the shoulder, I often do more of a drop table. I can also do it without a drop, but I'll do a drop in a lot of cases. Again, very light on the body. Elbows when needed, radius is a little bit out, just like that. Again, keeping the adjustment very short, not hyperextending at all, because I don't want to injure anything else. I'm really just trying to heal, not injure. And then wrists, which many people have wrist issues, as she does here. Very good. So that covers the primary adjusting techniques that I use. As I said, I tailor those techniques to the specific patient and their specific needs. And if you'd like to come in to make an appointment, you can come into the Auburn Racket Club where our office is located, or you can check out our website at www.presenceauburn.com or give us a call at 889-0388, area code 530. Thanks.